Hi, I'm Raya and I'm one of the creators of our Active Health Clinic members platform. So I thought I would share with you what it actually is. So this came from us as a clinic and as practitioners working with patients every day. We will often have a one-on-one session with them, and then at the end we'll send them an email summary and some links to our YouTube videos or a link to a playlist or whatever it might be. And we kept thinking that this could be easier and should be more universal. Another one was we do pride ourselves on making invisible illnesses visible and impacting 26 million lives by 2026, and we wanted to make sure that that was accessible as possible. And we understand that one-on-one services through Active Health Clinic may not always be accessible, whether that be where you are in your journey, whether that be financial barriers or whatever it might be. So we wanted to have a lower financial access point, but still quite a comprehensive option for people to engage with on their invisible illness journey. So we started to create this platform, and it got bigger and bigger over time, which is wonderful. So we have tier 1, which is our Learn tier, and that is a series of modules and playlists within those modules related to different content that's relevant to someone in an invisible illness journey. So that's teaching someone about the conditions, about the symptoms, and then about strategies and management and tools in the toolkit to help you deal with an invisible illness. Then we have our tier 2, which is our Connect tier, and that expands upon the first one and has so much more. So the Connect tier has longer videos and webinars and weekly help desks, which is like a live webinar Q&A type session that you can jump on and ask questions. It's kind of like a troubleshooting session with one of the clinicians here at AHC. It has a program, so a series and a sequence of videos to go through from start to finish, and it's very much a pick your own adventure, choose your own journey. So here at AHC, as clinicians, we are fantastic at meeting someone with where they're at. We understand that sometimes you meet us early on in your journey, sometimes you meet us and you're decades into your experience. So we're great at meeting the person with where they are and supporting them in filling in the gaps or making things more manageable or accessible and meeting the strategies to where they are at capacity wise. So we focus on translating from textbook and research to actually applying in everyday life. And we wanted to figure out how to do that on a wider scale. So our one-on-one service is absolutely phenomenal, and that's the one that we do suggest people engage with. But as I said, we understand that that's not always where people are able to meet us at certain points in time. So our AHC MP is the next best thing. It is an online platform, so you can either log in through a browser or it has its own app, and you get to choose what you engage with. There is an area in a section that you can do a quiz and it'll tell you where to start within the program itself, or there's different modules that you get to pick and engage with what you want on your own terms. So it's very much a self-paced learning concept that you can do for as little or as long as you need to. It can complement what you may already have as part of your healthcare team, or it can be the start and the foundation of then exploring what your healthcare team may look like. So it's really wonderful. It is in its infancy, so we only launched it late 2025, and it is growing and building every month. So every month it's getting new videos, it's getting new content, and it's getting updated, and we're very much listening to feedback from the people involved in it and making sure that it's a service and a program that is what the population is needing. So it's very much, if you suggest this, then we can do that, or whatever it might be. So it's very interactive and it's very accessible. So it is me in the back end answering your questions or posting the videos or going live, plus my colleagues, and it's actual real humans behind a program, which is really wonderful. And that's something that I think is really underutilized and something that may not that I'm aware of, kind of exist in this space. There are online programs per se, there are maybe group programs per se, there's some apps, etc. Like, I think there's a little bit of everything in this space, but we're really focusing on this being comprehensive to meet someone with where they're at and really do it on their terms, because you are the one who knows your health circumstances best. You know what you need and what you don't need, and sometimes you just need a little bit of help behind the clarity side of things, or revamping and understanding how to make that more accessible to you as a person and your circumstances and where you are. And the program aims to put all of that information in front of you for you to pick and choose what tools you yourself are putting in your toolkit. So I hope all of this makes sense. We're really excited to have this as a service that we offer at AHC, and we love that we're expanding it, and we hope that you love it too.